Welcome to the VCA Voice Podcast. I'm your host, Dr. Marie Kerl. Join us as we dive into inspirational stories about our caring and capable associates and their commitment to guiding healing journeys for our patients. Our discussions explore the important ways VCA Animal Hospitals proactively supports the future of veterinary medicine through leading the industry in medical excellence and providing hometown care to our communities. On today's episode, I'm happy to welcome Dr. Jose Carvajal. Dr. Carvajal is a veterinary surgeon at VCA Northwest Veterinary Specialists in Clackamas, Oregon. Hi, Jose. How are you today?
I'm doing great. How about yourself?
Doing wonderfully. I'm really appreciative for you joining, and I know we're going to have lots of great stuff to talk about. So I'm going to jump right in and hope that you'll tell me a little bit about your journey in veterinary medicine.
Yeah, so I grew up in South Florida. I'm originally from Colombia, but my folks moved here in about 2001 when I was 12 years old and stayed in South Florida for undergrad. I went to Florida Atlantic University, and there was a career fair, and a representative from the University of Florida Veterinary School of Medicine was there. Started talking to her, and she's like, you should apply. And I gave it a lot of thought, and I applied after, doing your externships during undergrad, and I was lucky enough to land at UF at the vet school.
That's an excellent program as well.
Yeah, I had a great time there, made a lot of good friends, and, it really shaped my life in a way that I didn't really expect. So very grateful for that institution.
So you finished school, and what happened next?
In vet school, I think, there's so many things thrown at you. And one of those is, you go in with a particular idea of what you think veterinary medicine is. And I think you start to realize there are so many things that you don't know, not only medically, but just opportunities that come to you. The main thing was just figuring out that there was something about surgery that I really enjoyed and something that I thought was worth pursuing. That didn't really happen until later on in vet school for me. But once that clicked, it became the only thing that I really, really wanted to do. And so as I finished vet school, I just, like your kind of average vet student, scrambled for a path forward in sometimes. And so that was the process of going through the match, so the VERMP, and doing an internship with the ultimate goal of becoming a surgeon. That led me in the path of visiting multiple hospitals and, trying to find a good fit for the general rotating internship that almost every surgeon has to do in order to become a specialist.
You spent all of your life in Colombia and then Florida, and you went about as far geographically as you possibly could go to Northwest Veterinary Specialists for your internship. Tell me about that process.
Yeah, it was two things converging. So the first thing is that my younger brother, about 2 years younger than me, is also a veterinarian. And we're both into mountain biking. And so one of these summers, we wanted to do a road trip through the States and make that a mountain biking trip, but at the same time, visit some hospitals and do a couple externships. I had reached out to VCA. I had an idea that I maybe wanted to end up on the West Coast. And I had something signed up in San Francisco, I believe. And I got to say, maybe halfway through the trip, I was in Colorado and I got an email and said, hey, unfortunately, our surgeons, have a medical emergency or they just can't be in the hospital. So unfortunately, you can't come to San Francisco, but there is an available spot in Portland, Oregon. I just said, I don't know anything about Portland, Oregon. Never been there, never really thought about it. But I said, why not? And when I landed here, it was almost fate. I shadowed two amazing surgeons, and I ended up being in the backyard of some world-class mountain biking as well. So from my eyes at that time, I was like, oh, this place is a dream. I have great surgeons. I had some great cases when I was a student with them. And then I just got to enjoy my summer as well. So after that, you put all the work in, you put your application into the VERMP, which is kind of the matching program for all veterinary interns, and things just landed me here.
I want to ask you, you're the first veterinary surgeon on the VCA Voice Podcast, and surgery is really difficult to get into. How rigorous was your training in your residency, and did you have any specialty internships along the way?
All these specialties are really difficult. I think it's all a matter of perspective. When you're a student, you're a pre-vet student, you just want to be one of the few that gets into vet school. That's all you hear about, right? And once you make it in, this is all you ever ask for. And then same thing for your internship and then finally residency. I think if I remember correctly, there's about a 20%, maybe a little bit under 20% match rate for surgery. So I remember I didn't do a specialty internship. I was very lucky. Ultimately, I did school at UF and I ended up at VCA, and I ended up back at UF for my residency. And part of that was some of the connections and friendships and kind of overall impact that the place had on me. But also, I got to know a lot of the surgery team there. And so that was kind of a dream for me because I was back kind of in my alma mater, and the surgery program there is terrific. I mean, at UF, they've just given, some of the, world-renowned, very good surgeons, very academic, very prolific surgeons have come out of there. And so I'm just really proud to be in the same type of environment as they have been. And so the caveat to all of it is that when I got there and I started my master's year, it was really fun. I got to do some great work. In the middle of my master's year, COVID happened.
Oh.
As I transitioned into the clinical portion of my residency, COVID just changed everything in terms of the way the hospital functioned, and honestly, the way we kind of all function to this day.
Right.
So it was pretty rigorous in a way, but I don't know if it was the same as the previous years and the previous history of the program. But, long hours, a lot of ER cases, a lot of ER management, a lot of nights on call, which, I don't know how often your nightly on-call duties were as a resident, but, it's something that definitely wears on you a little bit.
Yeah, absolutely.
Wore on all of us, especially with kind of the added stress of some of the kind of challenges we had to rise to during COVID. But I think it was totally worth it and very, very happy about it.
Now, you pursued some additional training to develop an expertise in joint replacement surgery. What led you to follow that path?
Yeah, it was basically finding a great mentor during my residency. So Dr. Stan Kim is an orthopedic faculty at University of Florida. And it was a combination of things. It was me kind of getting along with him and kind of learning a lot from him and being together in some of these cases. But in particular, the interesting joint replacement was my last rotation as a student. The first day of surgery, he had a total hip replacement scheduled. So it was an older golden, really arthritic hips, problems getting up. And we know that, older dogs can be at risk of complications with hip replacement.
Right.
He did the hip replacement and it fissured and it fractured the femur on one day post-op.
Wow.
And so this happens sometimes and it's a known complication. And we, unfortunately, obviously, we have to go back into surgery to stabilize the fracture. And so during my third day of the rotation, we go back into surgery along with another student. We fix the fracture. And before he leaves the hospital, the bone is so thin and kind of like eggshell-like that it fails. It fails again.
Wow.
And so here we are in the middle of surgery rotation with this very complicated case, these owners that just absolutely love this dog to death and they just need us to fix it. And so ultimately we reached out to the folks at the Joint Replacement Center across the street at UF and they reviewed the case and we're talking, it's like, well, this happens in, geriatric patients sometimes just have really poor bone quality. We have these cables, you can incorporate them into the bone plate and they're perfect for trying to stabilize what we call periprosthetic fractures or fractures next to an implant when there's poor bone quality. Mm-hmm. And so we get these special cables that they use in human medicine and we apply them for a third surgery and it worked perfectly. And so this kind of combination of meeting Stan and seeing this really complex case and being prepared for something, ultimately having complications, mm-hmm. and then having to be creative, that was really kind of interesting to me. That sparked kind of the initial interest in joint replacement surgery.
You brought up a couple of really interesting points that I want to touch on. First of all, when a surgery goes well and there's no complications, that's great. However, when there are complications, as a surgeon, it's your patient, you have to deal with those complications and sometimes go back in again. You can't just say, oh, well, this happened and we're done. It makes your specialty very challenging. And the second part that you brought up when you talked about reaching out to the joint replacement group on the UF campus, you're talking about human healthcare. And there's, I think, more similarities than differences between human and veterinary healthcare. Joint replacement and human healthcare is very, very common. But it's an area in vet med that is still pretty novel, and using that knowledge and skill from our human medical colleagues really speaks to One Health and how do we help our patients. And there's also instances of how human patients are helped with some of the knowledge and learning that veterinarians have. I love that story, and I'm so happy to hear that everything worked out. And I bet as a student, it really helped you to learn and grow through that process as well.
Yeah, I mean, I think being a surgeon is so rewarding, but there's the fallibility of being a doctor. You're a human and you do make mistakes and you're going to be faced with these mysteries that you don't understand. The real challenge about being a surgeon is that you're going to be faced with making tough decisions that ultimately make a big impact in your patients. But at the same time, you're going to make mistakes and there's things that you don't understand. It can be a heavy weight to bear sometimes, but it's a very rewarding profession, I think.
You recently returned to your internship alma mater at VCA Northwest Veterinary Specialist, which is in Clackamas, Oregon. We're really honored to have you back. Tell me a little bit about your surgery team there and what excited you about joining this team.
I was here as an intern. Obviously, things change throughout that period of time. But I kept in touch with some of the surgeons there over the years. And Dr. Scott Leger is still here. He was a surgeon where I was an intern. And he's had a progressively successful and pretty steady joint replacement caseload that he kind of developed over the years. And that was really great because he's kind of had this team that is familiar with the procedure. And, it's great to be a surgeon doing the surgery, but ultimately you need a great team to be able to provide these procedures in a safe, efficient manner.
Right.
And so he's kind of cultivated a really great culture of excellence here with the team. And that made it a lot easier for me to transition from, an establishment like UF to a private practice that has some of those similar goals in mind. And then ultimately the administration at VCA Northwest, we share a lot of the same values and a lot of the same vision in terms of kind of providing a world-class innovative service here. So not only are we trying to get a joint replacement clinic here, where we kind of become the premier go-to place for joint replacement surgery in the Northwest, but also a 3D printing angular limb deformity bone and joint center. And so we have the ability here to 3D print guide models and basically do 3D printed specific custom guide assisted surgery, which is a really kind of interesting evolution in orthopedics that has kind of taken veterinary orthopedics by storm.
Oh, I want you to tell me more about that because that sounds like a huge new innovation. Tell me about how that works.
So 3D printing is really kind of useful in veterinary surgery. With a lot of these orthopedic conditions, obviously you need to evaluate and assess the patient, and ultimately diagnostic imaging is key. Traditionally, we have radiographs, and orthogonal radiographs help you kind of spatially figure out where things are. And so in terms of angular limb deformity, where there's, medial-patellar luxation correction or anything like that, you used to have to rely on 2D images to try to construct a 3D shape in your head. And ultimately corrective surgery, there's a methodology for it, using vectors, but it was imprecise. And again, a large learning curve for this. And so 3D printing became really popular because you can take DICOM images, basically, the files for a CT scan or MRI, and import them into these softwares that can segment regions of interest and it can make them into a 3D virtual model. And that 3D virtual model can then be printed into a physical object with, at this point, special resins that are biocompatible and are sterilizable. So they can be sterilized and they can be used on the patient temporarily at this point in order to help you do surgery. The 3D printing is great in terms of just kind of being able to print the actual bone that you're seeing or the actual structure that you're interested in, and then applying that into your surgical plan. But we're also kind of gone above that. So not only do we have software that helps us create these bone models and kind of help us prepare for surgery, but we're also able to do virtual surgery now.
Wow.
So we take these segmented bone models in the computer, we can manipulate them, and then we can cut them and we can reposition them to basically mimic what we're going to do in surgery. So if we have, let's say, a bad MPL, a 4 out of 4 MPL with distal femoral varus and maybe some tibial torsion associated with that, we can make our kind of cuts as we would in surgery virtually, set the bone straight, and then assess it that way and say, okay, are we happy with the correction? And once we can do that, we can then design cutting and reduction guides. So we can make a little cutting jig, we can print it, sterilize it, place it on the actual bone of the patient, and it guides our sagittal saw to make the exact cut that we need to get the right correction. We've used it, several times here as part of our practice. Any sort of complicated case or anything that I think would benefit from a 3D model, we just need a CT scan. And the CT scan can give us all the information that we need to get a better idea of what we're actually going to do in surgery. And I think it's a night and day difference.
That's tremendous, especially when you think about the variation, especially in dog breeds, but both dogs and cats. And we treat dogs that are 5 pounds up to a couple 100 pounds, and trying to plan through orthopedic surgery with those kinds of challenges, this must really open up lots of avenues to know exactly what needs to be done before you even take the patient to surgery.
It's very popular, right? There's multiple companies doing variations of this. A lot of universities have 3D printing kind of incorporated. And so it is something that if you haven't seen it now, even as a general practitioner, as another specialist, you will at least start interacting with surgeons that come out of residency that are mostly exposed to this. So whether they do it themselves or they have one of their faculty or someone else do it in their institution, they're going to maybe even rely on this technology going forward. I definitely do think that this is something that is not really going to go away. It's kind of our little version of a Da Vinci robot.
Right.
But it has kind of unlocked this new level of understanding and this kind of new abilities to have consistent results, understand disease processes better, and be able to kind of educate clients more on what we're actually trying to do. Right now, it takes, a significant effort and some significant kind of training to be able to do this. So it took me a while to kind of get familiar with the software and familiar with the process. And so it does require somebody to go into their own time and kind of do this. But, this is a stepping stone. I think very soon, and we're starting to see this, is not only kind of this more automated process of bone model development, also guide and jig development, but also custom implant development, right? So the next step would be to have patient-specific implants that you can use to correct deformities, or patient-specific implants for joint replacement. This is something that definitely is in the pipeline, but we're not there yet, or at least it's not as common as we want it to be. But definitely we see a path forward with all the innovation that we've seen recently using this technology.
What joints can be replaced on a person, and where are we with that in veterinary healthcare?
Yeah, I think the question is, what joints are not replaced in human medicine? I think that's probably a shorter list. For dogs, I would say about 99% of joint replacement in dogs and cats is hip replacement.
Right. Okay.
Right. That is the most commonly replaced joint there is. But there are reports and there is prosthesis for other joints. Secondary to that, the most common second joint is probably total knee replacement that has about a 10 to maybe 12-year history of being available. Elbow replacement is something that we also do infrequently, but it is reported. And then the latest generation of prosthesis is also included an ankle replacement for dogs with OCD lesions.
Wow. Okay.
There are, these kind of scatter reports of other type of replacements, disc, so intervertebral disc replacement and things of that nature. The point being is that hip replacement is kind of the cornerstone of joint replacement surgery in veterinary medicine. It has been around. There's a lot of changes. So if you were to look at the original kind of design and reports of total hip replacement in dogs, is completely different than what we do now. The expectations are completely different. The outcomes are very different.
Right.
But the procedure itself is very, very similar.
Mm-hmm.
And in human medicine, it's very different because the person doing your joint replacement is very likely a fellow, and all they do is knee and hip replacements all day, every day. This is what they do. This is what I've been trained to do. And so their outcomes are fairly predictable. They have a wide array of implant options for your particular needs, your particular anatomy, your particular age. And they have a variety of implants and solutions available should all things go wrong, right? Which they inevitably do. If you or your loved ones ever need a total knee replacement, well, they have not only the right size, but the right side that you may need. And if there's a complication, well, they have exchange polyethylene plastics that they can use. They can do single stage revision, double stage revision. They have revision specific implants. They have fracture specific implants. So they just have this huge industry, right? Because of the need for total joint replacement at this point in a growing population. But they have all these solutions available. For us, The main reason why joint replacement has mostly taken off in the hip is because there's solutions to that.
Mm-hmm.
The same is not really true for something like an elbow replacement.
Right. Oh, that's true. Yeah.
So they're kind of these high stake procedures. We have an elbow replacement, but if something goes wrong because of this high learning curve that we associate with joint replacement surgery, we have limited options. And unfortunately, for a lot of our pups, it's bilateral diseases that are really common. For that reason, there's a little bit of hesitancy to really commit yourself to these joint replacement surgeries that are not a hip replacement. Hip replacement itself, like we talked about, does have these kind of consistent, kind of well-known complications. But we see it enough and we have enough options that you can kind of learn to deal with those complications and ultimately recognize when a patient is predisposed to one of these complications. And as long as the owner understands that, then they can make an informed decision about what's right for their pet.
Those are tremendous points. You mentioned a couple of times training and fellowship. And just to be clear for our listeners, you have to become a board certified surgeon first. And then there are a variety of different fellowships. Whereas I think in human healthcare, it would be akin to subspecializing in something to get additional training after you become board certified. You're starting a joint replacement fellowship at VCA Northwest Veterinary Specialist. Why did you decide to start that training program?
You're right. So the ACVS has kind of put forth this fellowship path where if you're interested in a particular subset of surgeries, you can specialize in them. The most common one and kind of the one that's been around the longest is surgical oncology. And so a lot of listeners may be familiar with that.
Right.
Surgical oncologists go through a 1-year kind of rigorous program where they're exposed to surgical oncological diseases and treatment. And they come out of that being able to offer these kind of subspecialized surgeries. And right now there's minimally invasive surgeries, fellowships, both in the soft tissue department, orthopedics, maxillofacial surgery, and then joint replacement is kind of the newest.
Mm-hmm.
And that's what I did. The year that the fellowship was approved was the year that I was finishing my residency. And so it just kind of lined up that I was able to stay in Florida to do my fellowship for 2 years with Stan Kim. And once I completed the case log, which was kind of a high number of cases under him, I was able to apply for a fellow status. And so with this fellow status now, it just kind of gives me the credentials to say, hey, I've had extra training in this type of procedures. But not only that, I'm able to then potentially have a fellow. So like you said, a boarded surgeon that also wants extra training and be able to offer that, right? With the ultimate goal of spreading joint replacement surgery to be more available. The reason why I started is basically two things. The first one is that, well, I think it's a great subspecialty, right? It's really rewarding and it's something that I enjoy deeply. I love talking about these cases. I love the ultimate results that we get, how happy clients are. And then the second one is just the fact that not a lot of people get exposure to. So it's my way of trying to, broaden, kind of spread the science of it. And the first step to do that would be to have a fellow here. And so in the fall, we'll have Dr. Kevin DeMoya, who's a current resident at the Colorado State University, that is going to be finishing his residency and then coming here to Northwest, but at the same time, train in joint replacement surgery with me.
Oh, wonderful. Well, that is excellent news, and I am strongly supportive of that program. I know that we worked through some of the details about it, and I'm really excited that you're going to do that, and I'm looking forward to hearing how things are going. We're now nearing the end of our time together. And in closing, tell me how veterinarians can continue to innovate and improve the future of healthcare for our patients and clients.
Yeah, I think in general, so kind of the best advice given to me is as you become a veterinarian, you kind of put yourself back into those shoes of early vet school. You kind of have to fit a mold, right? And so just like in any type of life transforming event, you don't know who you are as a veterinarian, your new identity. And so you conform to this idea of what you see around you. So all your veterinary peers, all the faculty that you meet, and you say, okay, this is what it's like to be a veterinarian. And this is what I do as a veterinary student and then as a young veterinarian. And as you get out of veterinary school, I think a lot of people, and me included, and I think just kind of a thing that happens is that you often struggle with things because you have this new identity, but you're still learning. Mm-hmm. Now you're kind of in a smaller practice and you were taught these things and you don't know how to keep doing them the way that you were taught. And the advice given to me is just go back to what made you before you had this identity switch as a veterinarian.
Right.
So what is it that brought you to this profession? And that's what's going to set you free. I guess I'm kind of an innately curious person. And so when I was in surgery, maybe I was a little bit annoying. And so, I just wanted to know everything. What is this? What is that? What do you do here? Why are you doing that? And so that degree of kind of innate curiosity and kind of annoying tendency to ask too many questions led me to be exposed to these things and ultimately led me down the path of 3D printing and joint replacement surgery because I was willing to ask the questions and kind of follow my curiosity. How can you make your profession better? By making your practice better. The way you do that is by following the things that you're innately interested in and good at and making that the focus of your practice. For me, it's that simple. Just do what you love to do. Eventually, I think, for me at this point, very grateful to do the things that I do. And hopefully, by doing that, I have some impact in the people that I work with and the people that I come into contact with, and little by little kind of make the hospital better and then, the profession better.
Well, that's wonderful. And it has been such a delight to speak with you today. Thank you so much for joining me. And I look forward to hearing about the future success with your program.
Thank you so much.
Thank you for listening to today's episode. We hope you enjoyed it and learned a few helpful tips. If you haven't already, I encourage you to subscribe and listen to our previous episodes to hear the many valuable insights and lessons from our past guests. Don't forget to leave a review for today's episode and share with friends. Make sure to follow VCA Animal Hospitals on LinkedIn, Facebook, and Instagram to stay in the loop. For more inspiring stories, visit our website at vcavoice.com.